All right, and then we will go ahead and get started. Let me share my screen. Okay. All right. So if you're not with the schools or the health department, we'll ask you to drop off the call just so we can save the full hour for questions and answers for our school staff. Everything will be posted online within the next few days. And make sure you pass on any information to your frontline staff as they need it. So just sharing the weekly increases in cases in the state of Michigan. This was as of last week. Just as you can see, our case counts continue to climb up higher and higher than they ever have in the past. We're seeing this trend nationwide as well. I plotted the total cases for the 19 counties covered in Mid, Central, and District 10 since the beginning here, just so you can kind of see the rapid increase we've had here more recently. I'm sure you all can tell by what's happening in your area that this is happening. They have yet to really post hospitalization data on the My Start map or My Safe Start website like they said they would. They're, I think, still figuring out how to do it best. But on the Michigan data website, if you dig deep for it, you can find some info on hospitalization rates and capacity. It's broken down by healthcare systems. And I just have it posted here for you. This is really as specific as we can get for our area. The website is here, but just so you can see that, you know, at most our healthcare systems have 25% of their beds, or I should say at least they have 25% capacity left open. Most are only about half full. So even though we are seeing big increases in hospitalization rates, we still have capacity available. Some of these, as you can see, like with McLaren, they're giving data for all of their healthcare systems, not just the one hospital within our territory. So that is available at this website if you want to keep a track on that. They also have it broken down by healthcare coalition region, which is usually a clump of about 13 to 15 different counties. So just to give you an idea on that, but that is something that is being tracked pretty closely. So I went back like last week and I pulled the last 2 weeks worth of data. These are confirmed and probable cases that were reported to us from this past Monday to 2 weeks prior. So this does overlap a little with the data I reported last week because I pulled the 2 weeks prior as well. So there's that middle week was overlapping. So of all the cases reported in the 19 counties, only 8% of them were in people that either work or attend school. 3% of them were in teachers, so 3% of the total, or about a third of all the school cases were in teachers or staff, and 2/3 of all the school cases were in students. So looking at all the cases we had, about 5% were in school-age people going to K through 12 school. In all of Michigan, 10% of our cases are in kids that are ages 10 through 19. So just as a comparison, we only had 5% of cases in K through 12 students. So basically what I'm trying to say is that's a lower percentage than the average of total kids in Michigan that are in that age group. They have it broken down in like 0 to 10 and then 10 through 19. So it's a little bit harder to compare, but this would the K through 5 is, or sorry, K through 12, as you know, would be more like 5 or 6 years of age to 18, 19. So that's, to me, a lower percentage of kids than we'd expect to see just on average based on that. So, sorry, I'm like a easily distractible person here with pop-ups with questions and things, so bear with me. So since last meetings, and I know we've had more coming in since Monday, since the date that I pulled these numbers, and I know not everything gets flagged quite perfectly, but really I only saw 5 cases that were technically considered part of a school outbreak. One of those outbreaks had 3 people, one of them had 2 people. And again, the start of that outbreak was someone who acquired it in the community, and then the rest of the people in that outbreak were cases that were from spread within the school. So really, of those 5 people, only 3 were cases that were acquired in the school. But still, I took those 5 cases out of our 66 cases total, and therefore about 61 cases out of our 66 cases were really community acquired cases that came into our school, and they were all unrelated. So 92% of our cases were all separate community acquired cases. Holy, okay. All right. So that's just, again, these are very rough numbers. I basically just pulled our cases and had to search through all of them to find the cases that were from schools. So, you know, some of our cases were not fully worked up yet, and the nurses didn't have full notes in there yet. So, so these are not perfect numbers, but it's a pretty good estimate just to show that we're not getting huge numbers of cases in the school, and we're certainly not seeing any major kinds of spread within the schools. So we'll look at our data overall for our communities. I had this disclaimer on here last week. It's really hard for us to quantify how much this is happening, how much it really is happening, but we have more and more areas are doing rapid antigen testing. That's kind of like a rapid strep test where they just swab you, here in this case, they swab your nose, and do a quickie test in the office. And there isn't really a paper trail, so to speak. They report it to us sometimes verbally. We try to get them to write it on a piece of paper for us, but they're not reporting all the negative tests like they do with PCR testing. So when we're talking about percent positivity, our math is getting screwed up because we don't know our total number of tests now. And for example, Ferris has started to do rapid antigen testing on their students. And so you'll see that in Mecosta County, their percent positivity has gone up. And I'm sure part of it is because they're doing a lot more tests, but they're only reporting the positives. So again, we know that that's having a factor in it. We just don't know how much right now. So we'll go to our data here. Come on. Okay. So we will send this out as usual, and I think we do post it online as well, but we'll make sure to get this out. And this is basically just pulled right from the My Start Map site. This was pulled on the 3rd, and I think a few of the counties were pulled yesterday. So pretty much just about everybody is either in the very high or the highest category here. Michigan as a whole has had a significant increase in their daily cases per million and in their positivity rate for their tests. This is Central Michigan District Health Department. Again, they increased from 161 to 227 on average for cases per million per day, and the percent positivity continues to go up. Again, most of the counties are in the 200s. This is District 10. Likewise, they've had, on average, things have increased. Like I mentioned here, Mecosta is just over 10% positivity rate. But again, by doing antigen testing, we're getting positives, but we're not really knowing how many total tests are being done. So our math is not quite right there. This here, you'll see, this is the case, the weekly trend. So Mecosta actually went down over the week. And Mid-Michigan District Health Department, likewise, their average went up over the last week as well. So everybody's continuing to go up, just like I said, like the state and the country. So we continue to get questions about, in-person versus remote education, because the document, which the long name is the Interim Local Health Department and School District Guidance for Increasing and Decreasing Intensity of In-Person Instruction in Michigan School Districts, which we often just call the matrix. It is what it says, it's guidance. And so it says in the footnotes, it is for consideration by us and by you. So it is not a rule, it is not a switch that once you pass a certain mark, you have to turn things off or on. So we are continuing to just evaluate the situations in the schools and give guidance. Based on the data I just discussed, it appears that the cases that are being seen in the school, over 90% of the time are due to community acquired cases that happen to go to school or work in the schools. There's very little transmission actually happening within the schools. So in other words, the schools are not the source of COVID, it's the communities. So from a public health standpoint, we don't really have a burning need or feeling that we need to tell you that schools are unsafe and that you need to change to remote education. However, if you are having excessive disruption to your education because you're getting a lot of cases and you have to do a lot of contact tracing and quarantining large amount of students and staff, and then, things settle down and then the next day you have to do it all over again. And it's just this never ending cycle. And it would just be easier if everybody was just home for a while or indefinitely, because this is more disruptive than trying to have in-person education, or you're facing excessive worry from staff and families, and you need to make a decision that's best for your school. You as an educator, as an administrator, as a superintendent, as a school board, you can make what decision is best for you as a school. If you're making those decisions, I would suggest as much as possible to try to keep the K through 5 grades or even the K through 8 grades in person as long as possible, because it does seem that the risks of transmission from those younger students to each other or to adults is lower. And with the younger kids, childcare is a bigger issue. So keeping those kids home would keep parents home, and it would actually impact our healthcare system and other things. Plus, those kids just do not, of all the kids, we know that they don't learn as well remotely, but those younger ones especially do not do as well with remote learning. So, so again, that's the very long spiel about in-person versus remote is, again, looking at everything. It does not appear that being in person is a risk at this point. However, we know you're getting more cases because of the community rate. And it's not that schools are making you at risk for catching COVID. It's just that having more COVID in the community might make learning and make what you're going through a bigger disruption. And so you can make decisions that are best for you as educators. So this is really tiny print. It's more just to have for notes and a reference. Because of the exponential increases in cases we're all seeing, we are, as a health department, despite extra staffing, using extra resources, repurposing staff, we are overloaded and are not able to keep up with things like we would like to. And it's really unprecedented for us to be in a situation like this. So we may not be able to respond to your calls and questions like we normally do. We and then the state systems who are helping us may not be able to investigate cases or do contact tracing as quickly as we typically have. So we encourage you to continue to identify your close contacts and advise them to quarantine as soon as you find them. And I provided a link here. There's a editable handout that gives guidance on self-quarantine if you don't already have that available. The CDC has some good examples and illustrations using calendars to explain quarantine at this website. And then here are some links basically to some of the more commonly asked questions from the CDC, basically having it in black and white saying that a negative test won't get you out of quarantine. Household members to a close contact do not have to be in quarantine. If you're re-exposed within 3 months of your case, you do not have to be in quarantine again, things like that. And if you go to the FAQ section of the CDC, if you type in a keyword into the search box, it searches all the FAQs throughout the whole website. And it actually works quite well if you have questions. So I just share that so that if you do have questions, or these are kind of the big ones we get asked a lot. Hopefully that will provide you some help in case we can't get back with you as quickly as we would like to. The Michigan Department of Health and Human Services did reissue their guidance for contact sports. It's pretty much the same as it was in the beginning. They just added a section giving some mitigation measures for safer play and practice. Their recommendation is still the same. It still says that contact sports should be avoided at this time due to the rates of COVID in the community. That is still our recommendation as well. But again, they did add a section that talks about safer practice and play with use of face masks and other things. There's also a link on the bottom of that document, which has a nice table that really explains kind of the safest to the least safe measures you can take during sports for several different things you do related to sports. So that actually was a really nice document. We have seen many cases in those playing sports. We've seen some spread within teams. The bigger issue is that we've had to see a lot of people quarantined because of cases in sports, because they're all close contacts to each other, really. So, but we have seen some spread within teams. So that is really it for today. I didn't have a whole lot. Let me get out of this and then I will questions. All right, maybe. Okay. So many pop-ups. All right, let me find the top of the questions here and then I will run through them. Okay, so the first question is, what is your current recommendation for school staff on quarantine due to contact tracing that have tested negative and do not have symptoms for at least 24 hours? Can they return? No. So if you are a close contact, you are on quarantine for 14 days, regardless of your test results. Reason why is that the test, on the best day possible, the test can have a 20% false negative rate, meaning that if it's negative, 20% of the time, that test is false. So if they've been exposed, even if they have no symptoms, they could still be pre-symptomatic. So if you let them return to work, you could find out in 2 days when they crop up symptoms that actually they were infected and they were contagious. So you have to wait out those 14 days.
Thank you.
Yep. And again, in the slides, I put the link to that because people don't like that answer. And we sometimes get healthcare providers who don't know that or understand that or things, but sometimes have it in black and white.
Yeah, Dr. Morth, I think what the concern is that if you're running out of staff, no subs.
Yeah.
But I get your response and I appreciate that. Thank you.
Yep. I understand that Spectrum Fremont is shipping COVID patients to Ludington.
What? I heard you got your car. Is it nice?
Oh,
You're lying.
hey, Sheila.
Oh, sorry.
All right. Darn mute buttons. I understand that Spectrum Fremont is shipping COVID patients to Ludington. I understand that Muskegon is opening their closed hospital for COVID overflow. It seems that we may be challenged regionally, and I don't know all of those answers. I am on the Regional Healthcare Coalition, and the medical director, Dr. Evans, actually is the director of the ER for Muskegon. And he had said that they were closing up that hospital and had no plans of using it for overflow. This was a couple weeks ago, though. So the last I heard, because we all thought that was a little bit unusual because it'd be nice to have a hospital sitting by just in case, but he was pretty certain they weren't going to open that other hospital up. But I don't know any of this. I certainly do know that we are seeing increased levels of hospitalizations. I'm pretty sure that Fremont shipping. I do believe some of those hospitals have routinely transferred their COVID patients because they're not set up to isolate them properly. I don't know if Kevin or anybody from District 10 is on that knows more about how those hospitals manage their COVID patients. But I don't know all the specifics to how they manage them. But we do know for sure that we're seeing more inpatients and more deaths. So the next question is, I know the health department has said numerous times that we do not need to quarantine if we travel. I'm getting questions from staff that the health department workplace screener states that if we travel, we will need to quarantine. I am assuming staff and students still do not need to quarantine. So our screener has on there, have you traveled? Because I have 3 different health departments. I know 2 of them ask about international travel or cruises, and I think one of them asks about travel with high risk behaviors. So it is still recommended that they've changed it from quarantine to stay home as much as possible for 14 days if you travel to a level 3 country, or you do a high risk activity. And then it also says you can consider it for high level areas in the US. So we do still recommend quarantine after international travel to a country, a level 3 country, which those are listed on the CDC website. And that's pretty much any country that people travel to. But it is listed there. Domestic travel is the trickier one. And that is just something you have to decide for yourself. I think when you say the health department doesn't recommend it, we just don't recommend a blanket statement. It's more of kind of your choice how you want to handle it. It just takes a lot more effort and decision making how you're going to handle it. And with our rates being so high now, there's not a lot of difference between travel within Michigan compared to travel within the US, but there is recommendations for international travel.
Thank you.
Yeah, I know it's confusing. But I know with Thanksgiving and Christmas coming up, it's going to be difficult. Is that rate of bed occupancy for COVID patients only, or is it's the total number of beds they have available? It is frustrating. Those numbers are frustrating, especially like with the ICU beds, because you don't know how many ICU beds they have available still. On that website up in the top, it does tell you for the region how many ICU beds they have available. But then for the individual systems, it doesn't. So they really haven't done the best job. And it really is difficult to get all that data together because all those hospitals have to report it separately. But no, it is. So like when they said they had 77% occupied, that means they have 25% of their general medical beds. So it's not like counting OB or surgery or things like that. It's their general medical beds that are available. With the new masking order, can our elementary students wear a shield? So if they have a reason they can't wear a mask, they can wear a shield, but it says that those that are over 5 need to wear a mask. Let's see, make sure I didn't miss something here. Questions for the end. If we have a student who was placed in isolation to a confirmed positive case of a patient who has been, okay, let me make sure I'm not confusing myself here. A student who was placed in isolation due to a confirmed case of a parent and has been and continues to be asymptomatic, and he consequently contracts and tests positive while away from school, say 10 days out from his last day in the building, what is our responsibility for posting and notifying the school community? I believe if you read the fine print on, let me see if I can pull it up in relatively short order here.
My question, and I do have.
I think if you read the school public notice is you need to counts of school associated cases, and school associated cases mean COVID amongst students, or anyone who was present on school property. So if they were not present on school property, so school property that may result in transmission. So since they were not present on school property while they were contagious, then you would not need to list it.
All right, so that was my question, Dr. Morse. Thank you for your answer. I'm wondering, is there an amount of time then to which you would have to allow? So I put a for instance right there of 10 days out. Right now we're not at the 10 days that he's been out. He has not been in this week. He was last in our building on Friday. But so far so good, no symptoms whatsoever. He's just out. So is there a day limit where you would have to do that or no?
Yep. So you are considered contagious 2 days before the onset of your symptoms or 2 days before you tested positive. So if he was a household contact to his mom and he had no symptoms at all, but let's say on day 10 they decided to get him tested and he was positive, then he would have been considered contagious on day 8. And if he was in quarantine from day 0, he would have not been in school when he was contagious. So, and if he started to have symptoms on day 10, same thing, he would have been contagious starting on day 8. So again, as long as he wasn't in school during his contagious period, it would not be considered a school associated case.
Thank you.
Okay. So I was afraid the pause meant I confused somebody. So, but if you ever have questions on those when they come up in real life, just let me know and we can talk through it. All right. So we have been hearing rumors that some schools are considering closing and going strictly virtual through or from Thanksgiving through Christmas. So, We've had some schools kind of bring it up as a thought. The universities and colleges are doing that because of concerns people will go home for the holidays and then come back infected. I did bring that question up to MDHHS. It was at least a week ago, if not 2 weeks ago, to see what their thoughts were on that. I'm really not holding my breath that we'll get any kind of an answer back. But I think that really is your discretion. If you really are seeing lots of cases and high community rates, and you're really worried that you're going to see this big explosion when you come back, you can decide if it's best, gosh, should we just not come back, or should we wait and see what happens? Again, that's completely your choice. But I have not heard from any schools that they've definitely decided to do that. I just know that some are wondering, and by some I mean 1 or 2 that I know of. So it's not anything major. If I do ever hear anything back from MDHHS, I definitely will share it with you. So the next one's about the governor's comments today. I did not even know she was talking today until I saw they shared her slides. But based on the governor's remarks today, do you anticipate us being virtual as a precaution since remote is possible? And I really can't comment because, again, I have no idea what she talked about today. I don't know. I don't even know what she talked about. So we're just going with what we feel is best. And if somebody tells us different, then we'll pivot. Are you indicating that schools can decide on their own quarantine dates? If so, what if we give a date and it's from the date the health department gives them or the state department gives them when they call? So the date is 14 days from their last exposure to the person who was contagious. So if the person was in school today with them and you send them home, it's 14 full days. So the count starts tomorrow. Again, there are calendars, a lot of really nice calendar examples on that CDC website. You can always say, we think you'll be off until this date, and if the health department changes it, so be it. What we know is likely happening is you may be telling them you're on quarantine, the health department will call you, and they might not hear from us or the state for 2 or 3 days. So if you want to just tell them they're off for 14 days and that someone will be in touch with them with their final return date, you can do that. But again, it's 14 full days past the day of their last exposure. We don't really expect you to have to figure all that out, though, if it's complicated, like if they're living with the person with COVID. So we just don't want you to, we want you to understand that it might be a few days before we can call some people, and want you to be able to have meaningful conversations with families and not feel like your hands are tied. And we know that there was a little snafu at one point where dates were different than they should have been when they were given by the state contact tracers. So we know that there have been some issues. If a student is quarantined for exposure to a positive parent and then later test positive while still in quarantine, does this time start over? So if someone is in quarantine and on day 8, let's say they're asymptomatic, on day 8 they test positive, they are now in 10 days of isolation starting from that date that they tested. So they would be essentially out for 18 days. So those 8 days of quarantine, then the 10 days added on of isolation. If on day 8 they became symptomatic, then they would be another 10 days from their symptom onset. So it's just basically they just switch to isolation and the rules that follow that. If a decision is made by one district or perhaps an ISD to do some type of movement to remote learning in a proactive measure, would you support us with a joint letter between, yeah, of course we would. And we, yeah, definitely. Again, we're never, well, I shouldn't say never, but unless there's some dire situation, we're not going to tell you when it's time to close your school. But we certainly will be supportive of the decisions you make. So what I've seen, let's see, this is a really tiny box to read from. What I've seen in the My Safe Schools Return to School Roadmap is our local health department guides Health Department guide recommends the 48-hour contagious period or 48-hour from test. But some parents have been telling us they were told only 24 hours. So I'm assuming you mean prior, the contagious period prior, and that's quite clearly documented on the CDC website. So the contagious period starts 48 hours prior to symptom onset and 48 hours prior to the date of their test. 24 hours has to do with fever. What we
Yes,
find,
that's what I was asking, because we've had a family say that they were notified by their extracurricular activity that somebody tested positive, but they were only going back 24 hours versus the 48 hours. Or no, I'm sorry. The person tested positive, say on Tuesday. The person that was with them last was on Saturday. So they wouldn't have been exposed if they tested positive on Tuesday. Wouldn't it have been Sunday?
right, and sometimes I know the confusion has been like, is it when you get your results or when the test was actually collected? So we want to make sure we're using the collection date. So if the test was actually performed or collected on Tuesday, then we'd only go back to Sunday.
Got it. Okay, thank you.
Yep. You guys will all be honorary healthcare providers by the end of this. So we have a family at Disney right now. Should we have them quarantined before returning to school? So that is up to you. They're going, so again, I think the incidence in Florida probably is similar to what Michigan is right now. I'd have to check again though. It was last time I looked. However, they're going to be in a crowded area. Who knows what kind of preventative measures they're following. So you'll have to make your own decision on that. The thing is you'll have to decide, whatever you decide, you'll have to apply that to everybody then. And then, if someone says, well, so-and-so went to a party in Detroit, and that's where it gets to splitting hairs. And so again, it's really your call on that one. Those kinds of activities are definitely high risk. And so you really might want to consider it. But again, it's just something then you'll have to be consistent with. And as we get past the Christmas holiday, you'll probably have a lot of families doing that. And how are you going to track it? How are you going to get people to report it? So I know not a good answer. It's not an easy thing for you guys to figure out how to do, but it is just something you'll want to be thinking about how you're going to handle it. I have had 2 staff surprised when they are coming off quarantine that their children must then quarantine 14 days beyond that. They did not isolate from them. Can this be shared prior to the follow-up call so they can plan accordingly? So I'm wondering if, I guess we can talk about that internally, if maybe the state case investigators are not properly educating them about their need to isolate away from their family. The other issue could be, it's just, especially if they're a single parent, or they have another spouse who's working, it is really hard for, depending on the age of the child, it's just hard to stay completely isolated away from your children for 14 days. But we can revisit that and see what kind of communication is happening. I know for the most part that has been well communicated, but again, I know that has been one of the harder one of the harder groups to do that, has been parents of children, because it's just hard for kids to not be around their parents for 2 weeks, because you really have to separate from them completely. Can I ask for clarification on the mask and face shield out lower elementary students are working on letter sound and need, oh. Clarification on the mask and face shields out lower elementary students are working on letter sounds and we need to be able to see their mouths. All I can tell you is that the epidemic order says that everyone 5 and up needs to be wearing masks. If during certain parts of, clear masks have been discussed. If there's certain parts of the education day where they need to shift to a face shield because of education and then shift back to a mask, I don't think anyone's gonna probably raise a fuss, but according to the epidemic order, ages 5 and up, and then lower ages in childcare, it's all pretty clearly spelled out in the epidemic order, need to wear a mask. So is there a threshold of cases in which it would be recommended that a building or district go virtual? So the matrix that I had mentioned previously is on the first tab of that data table, which we'll send out. It gives consideration if you're over 150 per million or over 20% positivity. So it says consider it, but again, it's not a rule. And since we're not really seeing spread in the schools, just seeing cases come into the school from the community, we've really just been following what's happening in that regard. So that was the recommendation. Those were the guidelines, I should say, that were made by MDHHS at the beginning of the school year. What guidelines are there to ensure that local daycares are informed of school outbreaks that may impact them? Specifically, if we know of students that are quarantined and are still attending. So I guess we trust the parents to notify the daycare. We've kind of gone above and beyond for the schools to tell you who should not be in school. I get a little leery about telling every organization in town who's supposed to be on quarantine, because people start to get, it starts to get to be a privacy issue. So I don't know. If you know that a kiddo goes to a daycare, I don't know. I don't know how to answer that. I guess a parent just has to be responsible. All right. Okay, so I am still confused about the risk levels. How can most counties be at the highest risk level and several of us are in counties where those numbers are double the threshold for level E? Is cases per million not a good standard? Doesn't seem that we should be able to double the highest risk category. Yeah, and that has been argued that cases per million, because most states and the CDC uses cases per 100,000. So I don't know. I didn't come up with that grading system. I think that was something between MDHHS and the University of Medicine or University of Michigan Public Health School. Because if you think about it, if you have 100 cases per 1 million people, honestly, that still isn't that many cases. And again, most talk about 100 cases per 100,000 people. Those categories were developed when this was first starting, and we really didn't have as many cases. So I'm not trying to argue we need to make different categories, but and we certainly have more cases. But I don't know that there's a good answer to that one. But if you do look at other maps on other websites or at other states, you will notice that their criteria are different and their their numbers are different. We had a student last here on the 27th. They did not return next day due to vomiting, stomach ache, and chills. They did not get tested until this past Monday. What's your recommendation on the situation? We are concerned because there is no communication from parent to school as to what is going on. So I'm just pulling up my calendar, 27th. So if they were tested, we at the health department can usually get a hold of test results. My suggestion on one like that would be to not let them come back to school unless the parent can provide a test result, or have them stay out the full 10 days. Because usually, if somebody's that sick, that is very concerning. And obviously, if a parent's not communicating with you, you kind of worry what's going on with the kiddo. So, but those are ones where, if you really just don't know what's going on, we can try and find the test result with you. We try to not offer that too much because, again, we just have really limited time right now. But if you just don't know and you can't really get help from the family, because kiddo might be in an ICU bed somewhere, you just don't know. All right, I don't see any other questions here. So if you have any others, you want to type them in or just unmute yourself and ask them. I know there's a lot of questions I just don't have answers for, but I am happy to try my best.
Thank you very much. Always appreciated.
And we thank you guys for being patient with us and all your hard work. Last call for questions.
Not seeing any. Everybody's just saying thank you and checking out. Take care.
All right, guys. So next week we'll go back to 1 p.m. unless some other meeting comes up. Hopefully not. But have a great week, you guys.
Too.